Thank you so much for joining us today. I'd like to start just by thanking Purina Institute for the opportunity to speak with you. And for the next 30 minutes, we're going to be thinking about idiopathic cystitis in cats, which I think we all recognise as a common and important problem. This slide summarises some data that was published a few years ago now from the epidemiology group that's based at the Royal Veterinary College in London in the UK. And they looked at a large number of cats presented to first opinion clinics in the UK to look at the common problems that these cats were presented for. Variety of different problems, as you would expect, but as you can see, almost 4.5% of these cats were presented because of signs of lower urinary tract disease. Now that's consistent with other studies that have been published, which suggest that usually between 4 and 6% of cats that are presented in general practice are because of signs of lower urinary tract disease. And of course we know that there are a number of different causes of lower urinary tract disease in cats. Urethral obstruction, urolithiasis, urinary tract infections, and a variety of other things. And of course we have this big category in cats that is idiopathic cystitis. Looking at epidemiological studies that have been published, again looking at the type of lower urinary tract disease that cats suffer from, we recognise that idiopathic cystitis counts for around about 55 to 75% of cases, typically perhaps about 55 to 60% of cases, and urethral plugs and urolithiasis are probably the other two biggest categories. In the past, we've thought that bacterial cystitis was very uncommon in cats, perhaps less than 2 or 3% of cases. More recent studies suggest that actually there may be a higher prevalence of bacterial cystitis, perhaps anything up to 10 to 20%, but certainly it's a much lower prevalence than we see in other species. So idiopathic cystitis is the biggest category of disease in cats that present with lower urinary tract signs. And this is a difficult disease. By definition, we don't know what actually causes the disease. That's why we call it idiopathic. There have been suggestions that stress may be involved in the development of this disease in cats. Historically, a number of cats appear to have developed signs of idiopathic cystitis following exposure to stressful stimuli. We know that the environment is very important. Many cats these days are kept primarily or exclusively indoors, and that can be quite a challenging environment for cats. They have very little control over the environment. They may not have very much variety, so it may be quite a boring environment for them. And again, we know from studies in other species, in zoos and other environments, that if there isn't a rich environment, if they're not able to explore and express their natural behaviours, that can be very stressful for them. So there's a possibility that the environment and stress in the environment may contribute to this disease. There's other objective evidence that stress could be involved in this disease, looking at, in fact, stress responses in cats. So a normal stress response, in terms of the neurohormonal mechanisms underlying it, there are two major parts to that. The stress is obviously recognized centrally in the brain. That results in corticotrophin releasing hormone from the hypothalamus, which acts on the pituitary to release adrenocorticotropic hormone, which then acts on the adrenal to stimulate secretion of glucocorticoids, etc. The other arm of that response is stimulation of the sympathetic nervous system. Again, that's a central response that's mediated through the adrenal glands to release catecholamines. So we expect that both arms, if you like, of that stress response will be stimulated. Interestingly, when it's been looked at in cats with idiopathic cystitis and indeed in humans with interstitial cystitis, these two systems seem to become uncoupled. There's certainly evidence in cats where it's been looked at that there is increased sympathetic activity associated with idiopathic cystitis, so there's evidence that they are stressed. They have increased circulating levels of catecholamines, but there's actually downregulation of cortisol responses, reduced adrenal sizes. So there seems to be a disparity here and an uncoupling of the normal stress response, at least in some cats where this has been studied. So this is one of these publications, came out of the research group at Ohio State University, and you can see the graph on the left there shows that compared with healthy cats, cats with idiopathic cystitis had a lower cortisol response to injection of adrenocorticotrophic hormone, and indeed those cats with idiopathic cystitis had smaller adrenals, lower weight of their adrenal glands, suggesting that there is stress going on in these cats, but the stress response may be a little bit abnormal. Now, if we think that stress is involved, hopefully we'd be able to identify environmental triggers for that stress. And there have been a few studies that have looked at risk factors for idiopathic cystitis, so looking at groups of cats with idiopathic cystitis and control groups, looking to see if there is a difference between them in terms of risk factors for development of disease. Interestingly, those studies that have been published have really failed to show any consistent risk factors, with the exception of obesity. That's the only one that was consistent across all three of those studies. Each of those studies identified other factors that appeared to be significantly associated with the development of idiopathic cystitis, but only in the individual studies. It wasn't something that was found across all three studies. So although things like conflict between cats in the house, or cats being confined to the house the whole time, or perhaps having access to a litter tray, things that you might associate with stress in the environment, these were not consistent risk factors in these studies, which certainly adds a layer of complexity, I guess, to our understanding of this disease. Just to add to that a little bit more, this was a study that was conducted again at the Ohio State University, where they looked at a group of 10 healthy cats and a group of 18 cats with idiopathic cystitis. And these cats were housed at the university in cages, and they wanted to see what would happen when these cats were deliberately stressed. Now, they didn't do anything particularly nasty, but it was just 5 days of disrupted routine for them. Unfamiliar people looking after the cats, disruption to the normal routines, being fed at different times, cleaned at different times, lights going on and off at different times. So nothing major, but just an element of environmental stress that was introduced. Now, interestingly, the cats showed signs that they were stressed, so that was having an effect on them. Reduced elimination, reduced frequency of defecation, that type of thing, some inappetence, so other signs that the cats were stressed. But interestingly, there was no significant increase in lower urinary tract signs in those cats with idiopathic cystitis compared to the control cats. So even when these cats with idiopathic cystitis were deliberately stressed, it didn't precipitate clinical signs developing. So stress may be involved, but it's not a simple picture. One of the other things that has been identified in these cats with idiopathic cystitis is abnormalities of the urothelial barrier. So we know that there is the epithelial cells, the urothelial cells that line the bladder, and overlying that is a mucus layer, glycosaminoglycans. This is a study that was published a number of years ago looking at the type of glycosaminoglycans that are present in that mucus layer in the bladder. And this study actually showed that in cats with low urinary tract disease, those glycosaminoglycans seem to be present in lower concentrations in the urine. Now, indeed, there have been other studies that have been published, 2 more studies that have been published more recently, that have also shown that compared with healthy cats, cats with idiopathic cystitis, whether or not they're having an actual episode of clinical cystitis at the time, cats with idiopathic cystitis have significantly lower levels of glycosaminoglycans in the urine. Now, we assume that the urine concentration of glycosaminoglycans reflects the layer that actually lines the bladder, if you like, that mucosal layer that's lining the bladder, mucus layer that's lining the bladder. So we assume that these cats with idiopathic cystitis probably have a poor mucus layer lining the bladder. Now, there are other abnormalities that have been seen within the bladder. Clearly there is inflammation present, but other abnormalities as well. This is a scanning electron micrograph of the normal lining of a cat bladder. Those are the individual urothelial cells, the umbrella epithelial cells that line the bladder. And these are two pictures from a cat with idiopathic cystitis. And you can see that there are areas of simple ulceration where the tight junctions between those epithelial cells are breaking down, and then those epithelial cells are simply coming away. So we have exposure to the underlying submucosa. So this also appears to be a feature of idiopathic cystitis, that these cats have disruption to the lining of the bladder. There is a breakdown in the normal barrier, there is an increase in the permeability of the bladder, and that may potentially contribute to the inflammation that we see. The real problem is we don't know if that is a cause or an effect of the inflammation that's going on. So whether one of the fundamental problems is a defect in the urothelial barrier, or whether there is a defect simply as a result of the inflammation that's going on, we still don't know at this point. So this is a complex disease. Idiopathic cystitis, we still don't understand it. It's potentially a single disease, but equally we may be dealing with a number of different diseases that we classify at the moment as idiopathic cystitis. Certainly there is evidence from evaluation of some of these cats that stress could be a contributory factor and that they may have abnormal stress responses. Equally, there is evidence from some of these cats that there may be abnormalities in the urothelial lining, and that, as we've already said, could be either cause or effect. In terms of clinical management, diagnosing this disease, it has to be a diagnosis of exclusion. We have to exclude other diseases that we know can cause signs of lower urinary tract disease, remembering that many of these cats with idiopathic cystitis will have crystalluria. That in itself is not an abnormal finding because many healthy cats have crystalluria. So the finding of crystals, microscopic crystals in the urine, does not indicate that there is some other underlying etiology. Assessing response to treatment in these cats is often pretty challenging because most of these cats get better, spontaneously resolve from their disease within a few days. They may have recurrent episodes. In some cats it can be frequently recurrent episodes, but each individual episode usually resolves within a few days. We know that prescribing antibiotics routinely for managing these cases is entirely inappropriate. It is still done quite frequently. This is a study, fortunately, from a few years ago now in the UK, but just looking at the proportion of cats presenting with signs of lower urinary tract disease where antibiotics were prescribed as a first-line therapy. Those figures are somewhat depressing, to be honest. We shouldn't be using antibiotics unless we know we're dealing with a bacterial infection. It's easy to diagnose bacterial cystitis with appropriate investigations, and we should reserve antibiotic therapy only for those cats where we know we're dealing with a bacterial cystitis. So what are the treatments? Well, if we're dealing with an inflammatory disease that is not associated with a primary infection, then using an anti-inflammatory drug like prednisolone would seem like a pretty good idea. And this was in fact investigated. Carl Osborne and colleagues investigated the value of prednisolone in the management of cats with idiopathic cystitis. So they looked at 6 cats with idiopathic cystitis, and they administered prednisolone at 1 milligram per kilogram twice a day, anti-inflammatory dose, for 10 days. What they found was that in these cats, clinical signs on average resolved within a day and a half, between 1 and 3 days, and even microscopic hematuria resolved pretty quickly, on average within 3 days. In all the cats between 1 and 6 days, that hematuria resolved. So on the basis of that, prednisolone is looking like a pretty good treatment for cats with idiopathic cystitis. But I've already said most of these cats resolve spontaneously quite quickly. And this study, in fact, had a control group. So this was a good placebo-controlled clinical trial. In the control group that were given placebo, their resolution of clinical signs was just as fast. Their resolution of hematuria was just as fast. So in fact, prednisolone was having no clinical effect whatsoever in these cases. Other treatments. Well, if this is a disease that could potentially be caused by a deficiency of that glycosaminoglycan layer, that mucus layer that lines the bladder, could we supplement these cats with glycosaminoglycan, either orally or by injection? And would that help to reduce clinical signs and recurrence of episodes of idiopathic cystitis? Well, both pentazan polysulfate and glucosamine have been used as potential therapeutic agents exactly for that purpose. But in clinical trials that have been published, none of these trials have shown any significant benefit from the use of glucosamine or pentazan polysulfate. There was one interesting study as well that looked at oral glucosamine supplementation. That was looked at compared to placebo, so this was again a placebo-controlled study, and it was looked at in healthy cats as well as a group of cats with idiopathic cystitis. What they showed in this study was that, again, those cats with idiopathic cystitis had lower concentrations of glycosaminoglycans in the urine. When they supplemented cats with glycosaminoglycan by mouth with glucosamine, serum concentrations of glucosamine increased quite nicely, so the glucosamine was being absorbed from the GI tract, but in fact it was having no effect on glucosamine concentrations in the urine. So it wasn't in fact being excreted in the urine, so it wasn't even reaching the site where we wanted it to have activity. So it doesn't look like supplementation with glycosaminoglycans makes a significant difference in these cases. If stress is involved, then perhaps the use of something like facial pheromone, synthetic facial pheromone, Feline, perhaps that would be a benefit. The use of Feline was looked at in one study, a crossover study, again, so quite a well-designed study. That study showed that there was a trend for improvement with Feline. There were fewer days when these cats had signs of cystitis when Feline was being used, but it didn't reach significance. So it may be of some help, but certainly it's not going to be the answer to these cats with idiopathic cystitis. What about studies where we have found something that works? Well, the first study that was published that showed any significant benefit from an intervention in these cats was a study that was published back in 1999 in JAVMA. They looked at nearly 50 cats with idiopathic cystitis, and they followed them for a 12-month period, so this was a long follow-up. And these cats were allocated to be fed one of two different diets. And they found a very significant difference in the recurrence rate of signs of idiopathic cystitis between the two groups of cats. So in one group, 39% of the cats had recurrent signs of cystitis. In the other group, it was only 11%. And the difference between those two groups was that one was fed a dry cat food and one was fed a wet cat food. So the cats receiving the wet cat food had a lower rate of recurrence, significantly lower rate of recurrence of signs of cystitis. Both of those diets were urinary acidifying diets, so they were formulated in a similar way, not identical, but they were similar, and the wet diet produced significantly better results. So since then, there's been a common recommendation that cats suffering from idiopathic cystitis should be fed a wet diet rather than a dry diet. We should be encouraging water intake. Perhaps if nothing else, that will encourage more frequent urination. It will result in more dilute urine, which is less irritant to the bladder. So there are certainly ways that you could hypothesize that increasing water intake would be of benefit in these cats. Since then, there have been some other dietary studies that have been published. The one that I've already showed you is on the left-hand side of this slide. There have been two others more recently that have been published that have looked at therapeutic prescription low urinary tract diet for cats and compared that to a kind of supermarket brand of cat food or a lower quality type of cat food. Both of those studies showed that the therapeutic diet had benefits. It reduced the rate of recurrence of signs of idiopathic cystitis over quite a prolonged period of time. So these cats were having fewer recurrent episodes when they were being fed the therapeutic diet compared with a kind of cheaper supermarket type diet or regular cat food. One of those studies showed a trend towards improvement with wet diet rather than dry diet. The other found no difference between wet and dry diet. And it's difficult to know what's going on specifically with the improvement that was seen in those studies. The difficulty is that there are so many differences between the diets that were fed to those cats that it's impossible to tease out what actually was making the difference. Certainly we can say from those studies that it seems feeding a high quality diet, as well as perhaps a wet diet, feeding a high quality diet is likely to result in better long-term prognosis in cats with idiopathic cystitis. What specifically makes the difference, we don't know. Whether it's mineral content, whether it's things like antioxidants that are present in the diet, whether it's anti-inflammatory agents, things like essential fatty acids, whether it is the effective diet on the urinary constituents and urine pH. Lots of different things that could be going on. So we don't really know at this point, other than to say feeding a wet diet seems to be a sensible approach, and feeding a high quality diet. Whether it needs to be a urinary therapeutic diet or not, I think very much open to question, but feeding a very high quality diet is likely to be beneficial. The other thing that has been consistently done over recent years in these cats with idiopathic cystitis is to try and modify the environment to reduce stress. There was a study again published from the Ohio State University group looking at the effect of what they called multimodal environmental modification, looking again at quite a large group of cats with recurrent episodes of idiopathic cystitis, following them over a number of months, and asking the owners to modify the environment, telling the owners not to blame the cats if they have episodes of cystitis and urinating outside of the litter tray, not to add to the stress of the cat by blaming them, so not to punish the cat, feeding wet food, increasing water intake, making sure there were sufficient numbers of litter trays and that the litter trays were being cleaned out on a regular basis to encourage urination frequently, and improving interactions with the cat, giving the cat things in the environment to play with, getting the owners to play with the cat more, trying to reduce and modify any tension and conflict between cats in the environment. So a whole variety of different things to try and enrich the environment and reduce stress. And what this study showed was that in fact, these cats had a very significant reduction in the frequency of their signs of idiopathic cystitis in the months after instituting those changes. There were other improvements, reduced fear, reduced nervousness, and so on. So it did appear that these cats were having reduced stress and reduced recurrent episodes of idiopathic cystitis. Should be said, though, that was an uncontrolled study, so we don't have a control group to know whether this was at least in part, spontaneous improvement of these cats over time, but at least some evidence that reducing environmental stress may also be of help. So right now, how do we approach treatment of cats with idiopathic cystitis? First thing, we need to look at the diet. The evidence that we have suggests that we need to be feeding these cats a high quality diet and probably a wet diet rather than a dry diet. So those are strong recommendations, a high quality diet and a wet diet, so that we can encourage water intake, produce more dilute urine that is less irritant. Those cats are going to be urinating more frequently. That appears to be of benefit. Should also look at the environment and look at litter boxes. Are there enough litter boxes, litter trays in the environment? Are they being cleaned out frequently? So looking at the number, the site, the size, and the type of litter boxes that are present, the type of litter that's present, and looking at other aspects of the environment. Environmental enrichment, trying to reduce stress, perhaps thinking about the use of synthetic pheromones as well, to, again, just try and help to make that environment a less stressful environment for the cats that are living there. And those are the main things right now that we think have an effect in cats with idiopathic cystitis. There are other approaches, drug therapy, glycosaminoglycans, we've talked about, no evidence that they actually work. There are drugs like amitriptyline or antihistamines that are sometimes used. Again, we don't have controlled studies to show that these work, and they are associated with side effects as well, so we certainly wouldn't choose to use drugs as a first-line therapy because we don't have good evidence of their efficacy. Analgesics, potentially, in the short term, because some of these cats undoubtedly feel quite a lot of pain and discomfort, so perhaps non-steroidal anti-inflammatories for a few days, that would be sensible as well to think about. So this is a disease where really we have more questions than we have answers. Is it a single disease entity, or are we dealing with many different diseases and we just haven't been able to sort these different diseases out at this point? Is stress involved? Is it involved in all cases or some of the cases? What exactly is the role of stress, and how are we best placed to try and study that and study the effect of modifying stress? It's not an easy thing to do. Even dietary intervention, although there is evidence that that has a beneficial effect, we don't know how that is working at this point. So certainly more that needs to be done with that, and also, of course, looking at that aspect of urothelial damage and the mucus layer that lines the bladder epithelium and finding out what's going on with that. So many things that we need to look at, many questions that remain unanswered. But at the moment, I think the best we can say is we don't have a magic bullet in terms of a drug, so we're looking at other things, trying to reduce stress, trying to improve urinary health in these cats, and using good dietary intervention as well to try and improve the clinical signs and reduce the recurrence rate of idiopathic cystitis. Thanks so much for listening. I hope that's been helpful, and I'd be happy to try and answer any questions. Thank you very much.